Chair, Vice Chair, Commissioners, and ex officios for the opportunity to present today. I'm Roxane Waldron, for the record, and I'm the State Problem Gambling Program Administrator at the Division of Behavioral Health and Recovery at the Healthcare Authority. And I just want to state early on that the program is neutral on gambling. We provide services to individuals and their loved ones who are negatively impacted by problem gambling. And I know that the Evergreen Council on Problem Gambling after me is going to talk a bit about what they have been doing for Problem Gambling Awareness Month. And so I'm going to share a little bit about what our program is doing, and then a few updates about the work that's going on in the State Problem Gambling Program, as well as what we do. And a lot of this work, I just want to say, is the result of hard work from many of the folks that are here, from many partners, including current and past commissioners and ex officios and staff. So I want to acknowledge that, especially in the past 5 years. So next slide, please. So before we talk about Problem Gambling Awareness Month, I'd like to share that we've hired a Problem Gambling Prevention Coordinator, Jeremy Whitaker, who is here. And one of his missions is to expand HCA's Problem Gambling Prevention outreach and awareness messaging from 1 month a year, really from Problem Gambling Awareness Month to the entire year round. We know that gambling goes on all year, not just 1 month. And so this is an example of social media messaging that went out about the Super Bowl this year. And we'll be working toward messaging throughout the year, especially during potential high betting seasons or times like the start of the NFL season and so forth. All right, next slide, please. So for Problem Gambling Awareness Month, HCA, Healthcare Authority, shared both social media posts and information on our HCA landing webpage that anyone can visit at hca.wa.gov, as well as on our internal HCA intranet for our employees. We also boosted and shared social media posts by the Evergreen Council on Problem Gambling and the National Council on Problem Gambling. Next slide, please. And for the first time, I believe it's the first time, the Gambling Commission, the Lottery, and the Healthcare Authority released a joint press release, which Director Griffin had mentioned earlier. And again, you can see that on our hca.wa.gov website. And there is a click that you can click there to go to a link. You can actually read the press release. And we also created a Smart Health activity for problem gambling. If you're a state employee, you may be familiar with Smart Health. It's available for all Washington State employees as a way to earn points toward having a slight reduction in your healthcare cost during the year. And so it's a big incentive for people to learn about specific topics. So that'll be up till the end of April. Next slide, please. All right, I'm going to give very, very few facts, but there's a lot more to know, and I'm happy to come back and talk about it in great detail, as all know. I'm going to share a few facts about gambling and problem gambling in Washington State. This is based on our 2021 survey, which is the last one that we did. It was a Washington State adult problem gambling prevalence study, and we plan to repeat it in the 2027-2029 biennium. So a lot of things have changed since then. This had to be administered due to funding during COVID, which was not the original plan. So we know that fewer people gambled, but we were able to look at the percentage of people that did gamble. And what we found that was that 4/5 of folks who gambled, 80%, were never going to experience a problem. They don't have any indicators of having a problem with problem gambling. So most people are able to gamble without any negative impacts recreationally, no problem. Then there was the 16.5% of the remaining 20% that were at an increased risk. The risk was not zero. They might have one or more indicators. Many of those folks will never develop a problem. A few most likely will. And then there is the 3.5% that's remaining of that 100% that were at a moderate to severe risk for problem gambling or even gambling disorder. And that number is estimated to be around 90,000 adults in Washington State. Again, we had fewer people gambling in 2021, so likely that number is probably larger now since more people are back to gambling. For the 16.5% that were in that kind of gray area, we were estimating about 420,000 adults. Again, that could be more now. So we want to make sure that when we're targeting our prevention, awareness, and early intervention messaging, we are looking at the folks that might be in that gray area, as well as offering treatment to those that are, seeking treatment for problem gambling or gambling disorder. All right, let's see. Yeah. So a couple of things we found was that when we asked about adults if they were gambling online, we found that 11% reported of those that were gambling reported gambling online, despite that online gambling is illegal in Washington state. And the more ways that adults gambled, the higher their risk was for problem gambling. So if they were doing one activity, buying a lottery ticket every week for a year, that's just one activity. The risk was very low. It tended to be around 1%. If they were gambling in 4 different ways, for example, maybe doing lottery tickets, online, they might be online gambling, whether it's legal or not. You can unfortunately access it without too much difficulty. And then going to a card room or a casino, that increases the risk. So if they were having 4 or more activities that they were doing, that increased their risk from 1% up to 13%. So it's just something to be aware of. Youth and young adults who gamble are at double the risk for problem gambling than adults in general. Adults in general have a 3 to 4% of those who gamble, and we're still right in there at the 3.5%. Well, really 2 to 4%, but ours was on the higher end in 2021, that are at a risk for moderate to severe problem gambling. For youth and young adults, it's double that, between 6 and 8%. And that is a big focus for the state problem gambling program right now. So that's a lot of the work that Jeremy Whitaker will be doing and is doing already. He's really jumped in. We are focusing on youth and young adults with our internal prevention program at the Healthcare Authority for problem gambling. And then in the Healthy Youth Survey in 2023, which is administered throughout Washington state, 10% of 10th graders reported having gambled in the past year. We did give them a little clue as to what we meant by gambling. It could be online, it could be this, it could be that. And we found that 10% had said they had gambled. Again, that is, online gambling is illegal, which we assume much of that might be. We're going to be adding a question to the next survey that comes out this year to say, well, what is it that you're doing online when you're gambling or gaming? So we can get a sense of what those activities actually are. Some fall into a gray area, but between gaming and gambling, where youth and really anyone might not necessarily know that what they're doing is gambling. An example of that would be loot boxes, where you're purchasing something, but you don't know what you're getting. So you might be wagering your money to get a prize, but the outcome is beyond your control. So from the problem gambling point of view, that is that could be considered an aspect of gambling. And so for youth, it's particularly important that they understand what that looks like, and that is a big part of the efforts that we'll be working on. The other thing is gambling under age 18 is illegal. So we know that the longer you can wait to gamble till you're legal, the less likely you are to develop a problem later in life. If you have been gambling from an earlier age, underage, that is a known risk factor for developing a gambling problem. All right, next slide, please. So if people want to seek treatment, how would they do that? Well, there are a few options. They could go through their private insurance. Some insurances do cover that. They could pay out of pocket, which some people can do, some cannot. Tribal behavioral health agencies, many tribal behavioral health agencies have problem gambling treatment programs that are wrapped in with other treatment that they are doing, and most accept will serve both tribal and non-tribal community members. So that's often a resource that community members may not be aware of in their area. The Therapy Fund Foundation is a new group, a new organization that started up. It is private, and it makes funding available for African American and other people of color. Treatment is free. And we do have several of our certified gambling counselors in training who are also listed with the Therapy Fund Foundation, so people can access free care that way. Medicaid now covers problem gambling as of last January, a year ago. And again, we'll have to see what happens with Medicaid, but I'm feeling optimistic since it's only a small part. Perhaps it will remain, I hope. It will continue to be covered. We probably will have served in 2024, I have to check the numbers, but my guess is between 75 and 100 people. So it's starting out small, but as the number of certified gambling counselors grows, we will have more people that can access services under Medicaid as well. So for individuals who don't have coverage those ways, or they can't completely cover their costs, our program at the state provides free assessment and treatment for problem gambling and gambling disorder. And we have contracts with about a dozen problem gambling providers, either sole providers or behavioral health agencies, excuse me, to receive reimbursement for outpatient problem gambling services. And we are also working with the Evergreen Council on Problem Gambling. They're doing a lot of the heavy lifting, actually. I want to give a lot of credit to them, to recruit more clinicians who are in areas of the state. I believe you mentioned that, Director Griffin, in your introduction earlier. We know that there's a number of areas of the state that are either rural areas or that don't have enough certified gambling counselors. And so Evergreen is working to recruit more into training. We're also doing enhanced scholarships that will allow folks that are in these remote areas to have most of their costs covered for training. So that would be lowering the barriers for our behavioral health agencies and people coming in for training. Then telehealth is also an option for treatment reimbursement now since COVID, which is awesome, because if you have people in another part of the state but they're willing to do telehealth, then we don't have that problem of not having enough clinicians in that area. We are also looking at recruiting more clinicians that speak other languages other than English. We've had several new certified gambling counselors brought on or in training that are speak Spanish and other languages as well, which is awesome. We also need folks that speak, Tagalog, Vietnamese, Russian, Arabic, Thai, etc. And so we are working on that. It takes a while to get a certified gambling counselor trained. Usually 1 to 2 years, sometimes a little more. And so we are in that, we have folks that are coming into that pipeline, and that is something Evergreen Council is really working with us closely on that. Finally, inpatient residential. I just want to mention that we do not have any inpatient or residential treatment for problem gambling or gambling disorder in Washington State. There are several well-known programs that are in other states, including in Oregon. Bridgeways is one. The Evergreen Council on Problem Gambling does have contracts with several. They have limited funding and have been great about stepping into that void over the years. We would like to have that be something that our program could pay for. And we are looking at that, but we don't currently have a residential treatment in Washington State. Hopefully we will have one soon. Whether they will want to contract at the rates we can pay will remain to be seen. But I'm hoping that we can at least perhaps in the future fund out of state as well. So thank you, Evergreen, for that. We also have a list of agencies that we contract with for problem gambling treatment. It's on our website. If you look at HCA and problem gambling in your browser, you will find our page. And so clinicians can, refer people, but also people can self-refer, and they can also reach out directly to state program, or they can go through the Evergreen Council on Problem Gambling. We have a no wrong door policy between us. We help equally. And also people can arrange for their own assessments with providers. Next slide, please. So I want to talk a little bit about who is eligible for treatment. So we have a low barrier program, and individuals who are assessed as needing treatment and are amenable to treatment but are uninsured or underinsured for problem gambling treatment can come for free and receive treatment. There is no limit to the number of sessions. We ask that if someone is doing well and staying with a clinician and wants to continue, that every 2 years they get reassessed to make sure that is the appropriate. But we don't want to get folks to the point where they're doing well and then say, well, that's it, go forth. I think maintenance is really important for recovery, and so we do have that program available for anyone. As long as the client is amenable to treatment, tests out that they assessed as needing treatment and would benefit from treatment, then they are eligible. And then loved ones can also go through the program. So if someone's struggling with a loved one who doesn't want to go through treatment or assessment, they can do that without going through assessment and get support. It's not for Medicaid eligible folks. As I mentioned, they would go through the Medicaid side through their managed care organizations. But if they get denied for some reason or they have a hassle around that, we certainly will cover them. We always have covered them. We will continue to cover folks that, are not able to get their coverage through Medicaid. So to access treatment, people usually call the Problem Gambling Helpline, and which will help connect people to treatment in their area. That is maintained and funded by the Evergreen Council on Problem Gambling. So those who are seeking free treatment can come to our website, find out who we have contracted with. We don't contract with all the certified gambling counselors. Some counselors don't want to go through a 38-page contract. We would love to have them. We'll work on them, but we have about, as I said, about 12 providers at this point. Okay, next slide, please. Okay, so in response to the Problem Gambling Task Force's final recommendation report, which I think that Director Griffin mentioned, that was delivered to the legislature in December of 2022. There were 2 companion bills that were introduced in that spring legislative session by Senator Conway and Representative Stearns, and they had support from Representative Klova and others. And so the Senate version moved and passed and was signed into law by the governor, took effect on July 1st, 2023. What that did was increase our funding for our program over two years. So now when we're starting the 2025-2027 biennium, we are coming in with full funding for this next biennium. Really exciting to be expanding on our work. So the bill basically, increased funding, required that HCA create the year-round problem gambling prevention program. We also started, it wasn't required, but we did start a problem gambling prevention work group. And that group is going to be meeting through June. And that group is essentially meeting to help craft and give feedback on a state problem gambling prevention plan that will then be incorporated into a statewide prevention plan in 2027. So we're in the stepwise. So we're in that part of working with our other partners. And then there's also another committee, which you had mentioned, the Disordered Gambling Advisory Work Group, or the DGAW, with HCA as the lead agency. That's an ongoing continuous group. And so in this last meeting we had on Tuesday, we went through all the things that have already been completed, the things that were in progress, the things we have yet to tackle. That yet to tackle is getting much smaller. So that's really exciting. Some of the in-process things will take a while, but it's super exciting to see that work happening. And then in addition to the changes from the legislative bill, we also got that approval for Medicaid to cover problem gambling. So now I'm going to share a little bit about the expansion of problem gambling services and prevention services. So next slide, please. Great. Okay, so we did talk about it being integrated year-round. We're meeting in that work group through June. Then we'll have a working version of a state problem gambling plan, which we are also, Jeremy's working hard in making that part of that of our work around that will be figuring out what our problem gambling program is going to be doing specifically, so how we will implement it. And then we are also working really closely with our other prevention colleagues at HCA, which is kind of a new thing and very exciting. And we probably will be doing a funding effort for community-based organizations that will help them integrate problem gambling into what they're doing with youth and in their community for the other topics that they're already covering, like substance use disorder and other things that are going on. Also mental health. And so that way it's not a heavy lift for them. So that's what we're hoping. So we're going to run a pilot program of that probably next year. And so we'll be able to report out on how that is going. And then we're also continuing our focus on populations that are at increased risk. These would be populations that are historically underserved, or we know are underserved, including communities that speak languages other than English, as we mentioned. We know there are some communities that are at increased risk due to socioeconomic status and the social determinants of health. And so we're focusing in on that. Evergreen Council, we're funding them to do a lot of that work as well. So next slide, which is the second to last slide, is on workforce development. And as I mentioned, another expanded focus is workforce development for certified gambling counselors. We did identify those areas, both the 11 geographic areas and the lack of clinicians who speak languages other than English, lack of problem gambling services within communities with populations at a higher risk. And then And then we also have a lack of clinicians that are from communities that are at higher risk who have lived experience. So we know that people often like to go and talk to counselors who have the same lived experience and come from the communities that they are being served in. And then finally, very excited to announce that training for the certified peer counselors, which is now actually a new WAC that just passed this last session, that increased the training for certified peer counselors from 40 to 80 hours. So these are people with lived experience, either themselves or their family members, loved ones. They can be certified. It's now considered a profession, and they now have to go through 2 weeks of training. And so because we had this opportunity, we were able to say, hey, since you're expanding your training, can we get in the door and have some information about problem gambling, gaming, internet use disorder? And so we were working with Tana to get some information added, maybe not as much as we would like, but, future. We have goals. And then the other exciting part is that the Evergreen Council on Problem Gambling is creating an in-depth training for peers who want to go deeper. We would like to have some certified gambling peers in Washington State who are, certified peer counselors who understand problem gambling themselves very specifically, whether they've experienced it or not, because there are very specific kinds of things that are different. Many are the same, but many, there are some things that are different around being in recovery from problem gambling. So that, and then also our program is helping to fund scholarships for that, so it will be free for peers who want to take that training. It can often be difficult for people to find the funding, and we want to lower that barrier as much as possible, which we think free will do it. So last slide, please. All right, this is me. I really appreciate the time to come and talk. And as I said, I'm happy to come back in the future or contact me. Loads of information if you're interested and not familiar with this. My contact number, the helpline number, and also, reach out to me or to Tana or the Evergreen Council on Problem Gambling. So I think that's it. Thank you.
Thank you. Does anybody and commissioners have any questions for Roxane?
Thank you, Ms. Waldron. Appreciate that presentation. It was excellent. And I'm sure, I could get this outside of this meeting, but I'm very interested in some of the demographics about the problem gambling folks in particular. I just see it break down sometime in the future of that.
Yeah, I'd be happy to provide that. We do have that information. As I said, we'll also be remounting that study in a year or two. Are you talking about who's at risk?
Yeah, the actual populations at risk. Yeah.
Yeah. So we do know that youth and young adults are at risk. We know that people that are doing online gambling are at an increased risk. They're actually at 3 times the increased risk. I'm not including in that. Sports wagering, legal sports wagering at tribal casinos, because that is geofence, that's different. But I'm talking about, the online gambling that in our state is illegal. That is an increased risk for problem gambling. We know that some populations of older adults, depending upon the specific demographics, are at a higher risk. We know that African Americans in our state are at a slightly increased risk for problem gambling. They may be at a more increased risk, but it's when you slice down those numbers really small, sometimes it's hard to say, you can see a trend, but it's hard to say that we can actually say with statistical significance that it's in that higher rate. But we do know that from other studies have shown that, Black, Indigenous, people of color, all at increased risk for problem gambling due to the social determinants of health, access to jobs, education, healthcare, schooling, clean environment. All of those things create impacts that put people at higher risk. Also, sometimes people live in areas where there's more likely to be gambling within cities. So some of that is what the environment is. So those are some of the areas that we know. There are military can be at increased risk depending on what kind of gambling you're talking about. It does break down a little differently depending upon the type of gambling. So, yeah. You think of any others?
Representative Kloba, did you have a question?
Yes, I do, Madam Chair. And I think it's entirely possible that Ms. Waldron is not the right person to ask, but I'm going to give a stab at it, and perhaps you can direct me to the right person. But I really do appreciate all of the emphasis on year-round problem gambling prevention. I think that's so important, and I think those the social media messages and things look like they would be very effective. The one of the tools, in addition to all of the fantastic treatment that you've been talking about, one of the tools that we can use is a self-exclusion program. And so we've got one up and running. Hope to, once the IT support is there, to be able to do it in a fashion that doesn't involve a stamp and the mail. But I was just wondering about the training that's involved for folks who are assisting customers with signing up for the self-exclusion, like when they are in the house bank card room, or other folks who are helping. Like one of the options is to go in person to the Gambling Commission offices and sign up for the self-exclusion program there. Do we have, or I'd like to understand a little bit better, what is the training that look like for that? Because I mean, I think there's subtleties about it, and some sensitivities that need to be employed when dealing with folks with those problems. So I wonder if you could tell me a little bit, I guess, about the training.
Yeah, I think I'm going to refer you to Director Griffin and Tana Russell, who's going to follow me. I think they can answer that more clearly. I don't want, I want to give them an opportunity to give you facts instead of whatever I might say. So I'm going to open it. But thank you for the opportunity. Thank you for the question.
No, and thank you for the presentation. Very, very good to hear.
But I think there are a few more questions.
Oh, are there?
I don't know if Director Griffin wanted to touch on that first.
Yeah, I can answer that question, Representative Kloba. So for the licensees, there is a requirement under the WAC that they go through annual training, I believe. And so that's set out, as I indicated, in WAC. And it is something that is a current topic that we're working with Evergreen Council in terms of submitting the documentation and engaging with our staff. When someone comes to self-exclude, we are working with Evergreen Council on Problem Gambling to develop a program, a training program for our staff that we hope to have memorialized through a video so that we can also have staff continue to refer to that and use it for new staff training as well. So certainly something that we are engaging with them actually last week. So hope to have that up and running in the next few months.
Oh, okay. Wow. Thank you. I appreciate that. I think the video sounds like a very useful tool. So thanks for that update.
Thank you. And then Commissioner Ibsen.
Yeah.
Thank you, Chair, and thank you so much for your presentation. Kind of a shot in the dark question, maybe more of a legislative or government relations question, but aside from the technological hurdle involved, I'm sure, is there any reason why self-exclusion could not be expanded to include online gambling?
I think the biggest hurdle is online gambling is not legal in the state. And so we don't have a mechanism in which to require the illegal operations to have a self-exclusion component. So I think that's my initial challenge with it.
Or the quasi-online gambling, I should say, like. Yeah, so you're kind of in that gray area.
We don't, if it's not authorized, it's not something that we could then, it would be a challenge then for us to impose requirements on something that's not legal in the state.
Certainly. Thank you.
I would say also that one of the recommendations that came out of the Problem Gambling Task Force report was to create a work group that looks at online gambling, online gaming, the intersection of gaming and gambling, and also internet use disorder, to look at those impacts on our state and to do some of that talking about what might be possible in the future. Again, we can't get in, ahead of what the legislators have determined.
Yeah, and I should clarify, Tina, apologies for the ambiguity. I didn't mean explicit gambling, but more like that. You mentioned loot boxes in
Right.
gaming, for example. That sort of gray area, not quite gambling, but sort of a gateway drug, if you will. Like if there's...
There was also a recommendation to look at consumer protections for youth around that exact kind of issue. There is a product called Gamban, which is out of the UK, but it does include thousands and thousands of websites that it will block. And that can be downloaded. It's not cheap, but it can be downloaded at any time by anyone. We have talked about trying to sponsor that through our program, but it's quite expensive. So we're still in the looking at it phase. And we also are looking at a couple of other apps that do different things, but that is one that anyone can download at any time. So that can be a tool that clinicians or others can use, even if we don't have a formal process in our state to ban online gambling for a specific individual.
Yes, and thanks for clarifying, Commissioner Gibson. And then to your point, I think, as you indicated at the beginning of your question, I think that the opportunity would be at the legislature level,
yes.
Potentially, maybe through something with that industry to have requirements on that industry. It's certain. Right now, it's not something that we could do anything with in terms of the Gambling Act, but potentially the AG's office has a consumer protection division, and that's where most of those sorts of things, we work closely with the consumer protection division and referrals when it might fall outside of the Gambling Act. And so I think that is certainly, as you indicated, a viable option to pursue that self-exclusion component for those activities.
And it just for shorthand purposes, is there a general catch-all term for that kind of not quite gambling, but effectively leading to gambling, whether it's an online gaming or social media or otherwise, just for the sake of avoiding word salad? Is there a shorthand term to refer to that?
Yeah, I think I'm going to let Tana answer that because she's the gamification queen of our work, and she presents on this all the time. So I would like her to give you an answer. We still also struggle towards having a term,
sure,
which is why we had a whole was a glossary in our problem gambling task force report to say this is what we agree that this means. So I agree that's tricky, but I want to thank you all, commissioners and ex officios, for your questions. Appreciate that opportunity to respond. So I'll turn it over.
I have one last question for you. Sorry. Yeah, I'm really interested in the youth and young adults piece in particular, and I'm just wondering, like, if you could give any more insight or like understanding on like marketing strategy, like, or what you guys are thinking around education and marketing to those youth. Because anyway, yeah.
We would love to come back and report on that specifically. Maybe in the next 3 to 6 months, we could come and give a presentation very specifically on the prevention, because we're growing that right now. Jeremy Whitaker has been very involved with working with our prevention folks in-house to figure out what's the best way, because we know that for youth, you can't message necessarily the same way for teenagers as you can for adults. With adults, you can say, be very scared, be worried. For teens, you cannot. You need to promote, positive norms, other ways of doing that. So figuring out what messaging they're using now, what kind of messaging we want to do around that is what we're figuring out. I'm not a prevention specialist, so I'm learning as we go. Jeremy has a deeper background in that, but we have to learn the HCA way, and they already have campaigns going on and that are pretty effective. So, but I'd love to come back and share and then get feedback as well.
I love that. Thank you.
Yeah. Thank you so much for your questions.
Thank you.